Thanks everyone for this opportunity. For a quick introduction, I'm actually a clinician with a regenerative medicine background. I'm with the American Board of Regenerative Medicine. So my topic is a little novel. So we are trying to explore microburst pulsatile oscillatory insulin in terms of how it can impact insulin resistance and benefit a lot of patients with any chronic metabolic disorder, not just type 2 diabetes. So I'm associated with STEMRx and Houston Metabolic Center, where we are doing a collaborative study. So, pardon me, mine is more of a case report. I don't have an RCT data as of now because this is a new project we have started. So I can just show you a few case reports just to give the idea that this is more, something that we can have more structured studies in the coming times. So, like I mentioned, the American Board is a not-for-profit organization. It's an educational board where we train clinicians, not only in the US, all over the world, where they can be trained to become a diplomat of the American Board through a rigorous training program. So, as we know, the background here is any chronic metabolic disorder we take, whether it's type 2 diabetes, obesity, hypertension, the fundamental issue is insulin resistance. And there is a lot of evidence which is currently being shown that the loss of pulsatile insulin is the driver of insulin resistance. So when you're in a healthy physiological state, insulin is being secreted from the pancreas every 4 to 5 minutes in a pulsatile manner, and that correlates with the other hormones. Somatostatin peaks so that the insulin secretion stops at that same point. So it's a pulsatile secretion which is important. And a lot of evidence is showing that insulin resistance starts developing when there is a loss of pulsatile insulin secretion. Right, and that is where innovative therapies like this have come in, and it's also known as mitochondrial activation therapy. Where we are using in our protocol. The specialty of our protocol is we are going a step further, where we are actually giving micropulsatile oscillatory insulin. So far, if you look at the current protocols like HAVA protocol and other continuous insulin infusion, although they are trying to mimic the physiological secretion, it is more they are not able to come to those micro bursts every 4 to 5 minutes. Every 4 to 5 seconds or 5 to 6 seconds, how can we have a small amount of insulin being delivered? So with this new device, the Bionica instrument that we are having, we are actually able to do that, micro burst secretions of insulin. So we have seen amazing results in the case reports at least, and we'd like to show you a taste of that in the coming few slides. So the idea is we are trying to mimic the physiological insulin secretion as close as possible. Every 4 to 5 minutes, a small fraction, micro unit of insulin is secreted from the device, and that continues for a period of 5 to 10 minutes, and it goes in cycles of 5 to 10 minutes, and each patient undergoes 1 or 2 hours of therapy, and that every week 2 to 3 sessions are given for a period of around 6 to 8 months. That is how we are trying to mimic the physiological secretion of insulin, and it is given at a hyperosmolar state. The insulin pressure is also higher than what we typically can achieve through a continuous subcutaneous insulin infusion, CSII. So that's how we are trying to mimic the physiological insulin secretion from the pancreas. So we have seen improvement in the HbA1c levels. Fasting insulin levels have tremendously improved. But this is, of course, we are measuring for diabetes patients. We have seen patients with, even with conditions like, to give you an example, conditions like PBC, right? Primary biliary cholangitis or autoimmune hepatitis. We have seen that is improving because autoimmunity also we have seen that it causes insulin resistance, and that when we are able to break that insulin resistance, a lot of the conditions improve. So the way I typically think of it is, if you have a wall, you want to break the wall. If you give an impact every 5-10 minutes and try to break it in a constant rate, you will not see results. But the more frequent you hit the wall, right, is a easier chance for the wall to corrode. The more frequency it is and the higher pressure it is, you get the breaking point and the wall collapses. So that's how I see as insulin resistance. It is there. If you want to combat the insulin resistance, the insulin has to hit the cellular walls, the cellular structure more frequently, like the physiological system, so that it breaks the barrier. And that's how the insulin resistance is basically addressed. So this is what is restorating oscillatory pulsatile insulin secretion, and that has shown to improve the Krebs cycle. The mitochondrial function is actually damaged, and the energy dynamics have gone bad. So we are presuming, scientifically, we are seeing that the Krebs cycles actually gets better, and the energy capacity of the cells improve over a period of time. So I'll just go on to the few cases I've had. So this can have a wide amount of impact in multiple case scenarios. multiple conditions. So this is one case who came with a pretty bad form of post an accident. He had severe brain injury, and he was an avid tennis player, as you can see here. So we had a course of therapy over a period of 68 sessions, and that's extending 6 to 8 months per se. And you can see the last picture where he's back to playing tennis. This is not exaggeration. This is actually a patient where we have seen this kind of a dramatic impact. And this is another patient who presented with metabolic associated steatohepatitis, fatty liver, and he is also doing tremendously well with this therapy. MDI is mitochondrial delivery interface, another name for this, and he's completed 30 sessions so far. He's doing well. And this lady is the one where I said primary biliary cirrhosis. PBC is an autoimmune condition, right, where the anti-mitochondrial antibodies are positive. She had all the other symptoms, as you can see here. And again, she's undergoing therapy yet. So I'm just, I cannot give you a conclusive evidence of how the parameters have changed, but subjectively, she's responding well to the MDI. So this is another patient with fibromyalgia and anxiety. So she's also completed 60 sessions, and she's also in terms of, so fibromyalgia is a condition where it's more of a symptom related diagnosis, right? We look at the symptoms, the pain points, and then we diagnose it. So subjectively, she's shown improvement in her symptoms at this point of time. And this is another lady with acute facial palsy. And we have seen that with 14 sessions, 88% of her facial palsy is much better. And she's got back the strength in her face. And this is a lady with age-related macular degeneration, right? AMD. And we are seeing that when we did an analysis, in terms of her vision, she's completed 36 sessions over 3 months, 3 odd months.
So any data is there? Only photographs or anything?
Data we haven't analyzed, madam, because we want long-term, at least 1 year data.
They improvise. However, we believe in you. It is a very important topic, but there should be some results. Would you
Correct.
like to share?
Correct.
Any-
So the data, I was discussing this, but my collaborators from Houston, etc., they wanted to wait for at least a year to collect all the data and publish it. So, but I was very keen to introduce the topic to the audience. So, sorry, I didn't. It is incomplete actually, but hopefully in the coming 4 to 5 months we'll have more data, and we'll be able to show it. Yeah, the device is available, sir. It's a Bionica. The conventional insulin pump, as I mentioned, it's more of a continuous flow. There is no way by which you can every 3-4 seconds, like a pulse, you cannot deliver insulin. So इसमें क्या है कि that every 3-4 seconds it gives a fraction of a unit of insulin, not even a complete unit. Every 3-4 seconds, it's just like small bursts. It keeps giving it, and you can actually, when you take the device, you can set it like that for 5 to 10 minutes. You put the time, and you put the way by which you say zero point 0.5 insulin every 4-5 seconds. You can set it like that. So what we do इसमें क्या है sir, one arm we have to give the insulin delivery, other arm we keep it open for 5% dextrose. So 5% dextrose on this is very important, sir. क्योंकि क्या होता है, generally the total amount of insulin which goes in for 2 or 3 hours will be close to even 100 units, 50 to 100 units. So there's a high risk of hypoglycemia. So due to that reason, through one arm there'll be 5% dextrose which is running, and we'll be closely monitoring the sugars with the CGM. And any tendency for hypoglycemia is there, we infuse the dextrose further. So the idea is to break the insulin resistance with this pulsatile secretion. It's a more sophisticated way of doing it. Exactly. The insulin pumps, the technology is not there through which it can deliver those small fraction every 4-5 seconds. If you give a continuous flow, madam, see, if I keep this, if I just keep hitting the wall continuously without taking the force and hitting it back, you'll not be able to break the wall. But if I'm doing it with great force every few seconds, that is what will cross the wall to get the break point. So that's the idea of handling this insulin resistance. Mike, exactly. So a lot of, yeah. So these are another patient with typical severe neuropathy as a consequence of diabetes, etc. Subjectively, the symptoms of neuropathy has tremendously improved when I've looked at her. And similar cases, this is fatigue syndrome that she's had. This is again metabolism associated steatohepatitis. And these are just and this is a patient with again a brain stroke. He had a hemorrhagic stroke, and now he's able to actually walk. He had left-sided paralysis, upper and lower limb, and now if you see, he's actually able to at least start walking. You know, so actually the results, it has a tremendous impact if you are able to explore it further. This is a patient with post-COVID fibrosis of the lungs and the post-COVID symptoms, as you see, and he is also having a tremendous improvement in terms of the fatigue has come down. The leukopenia is back to a state of normalcy. Post-COVID, he had leukopenia, so that's also improved. So yeah, so I think this is a patient with dementia. So when we actually did a CT scan, PET scan, we're actually able to show improvement in the neurological changes, the shrinking of the gray matter, etc. We have seen an improvement, in this patient over a period of, she's undergone 41 sessions. So even for conditions like, as we know very well, even Alzheimer's is a condition of insulin resistance, right? There's a lot of evidence which shows it's a type 3 form of diabetes. So that's why even the brain function, patients like this with dementia, they can actually improve with therapies like this. So I think that's my last slide. And this is again a patient with, for diabetic foot ulcers also, we have seen quite good improvement. One patient, of course, I didn't treat that patient, but I've seen when I visited the Mumbai center, the patient was actually on a verge where he was about to undergo amputation for the gangrene, right? He's undergone probably 20, 30 sessions. The discoloration is still there, but at least we have got him out from the stage of undergoing a gangrene. Discoloration is still there. The foot infection is resolved with the right course of antibiotics, etc. But we have saved his limb, you know. So that's the kind of impact we are able to see. So this patient is again neuropathy. He's also shown. So typically, neuropathy, diabetes-related problems, neurological conditions, we are able to appreciate very good changes over a period of time.